And various reports have linked loneliness to early death, with some including the U.S. Surgeon General comparing its health impact to smoking 15 cigarettes a day. However, a new international study led by researchers at the University of Waterloo School of Public Health Sciences has found that while loneliness is common among older adults receiving home care, it is not associated with an increased risk of death. Earlier, I sat down with John Hirdes, a professor for the School of Public Health Sciences at the University of Waterloo, to discuss the study and the factors that drove the surprising results.
Well, I think it's a function of the population that we're looking at. So we're looking at some of the most vulnerable older Canadians as well as citizens in Finland and New Zealand were part of our study as well. And so they're a different population from what you see in some of the reports that are out there about loneliness. So these are people who have major health concerns. And when you adjust for those health differences, those health concerns or risk factors, loneliness becomes less important. So there are some unusual things about that population, but we should also note that there's not actually clear scientific consensus in the general literature about loneliness and mortality. There may be some tendency to have overstated that and a tendency to not have taken into account some of those intermediary risk factors. So what we know, for example, is that lonely people are more likely to be depressed, and depression is a major risk factor for all kinds of adverse outcomes. And so, when you adjust for depression, loneliness becomes less important. There's also some unusual things about the home care population, and that is people who live alone and get home care have to be healthier than people who get care from family members. So to be able to live alone and be a home care client, you have to be in pretty good shape. Living alone also increases loneliness. So there's a bit of a selection factor that the loneliest people in home care are also the healthiest to start with. That's why they're able to live on their own, but that living alone makes them vulnerable to loneliness.
The study stated that loneliness varies across Canada, Finland, and New Zealand, and Dr. Hirdes unpacked how cultural or care system differences shape these outcomes.
Well, humans are social animals, and so having relationships with family and friends is a major part of our well-being, and it varies across cultures. I mean, some cultures are a little bit more restrictive in what they view as part of their communities. Others have a more expansive scope, and so one of the interesting points made by one of our colleagues, who's a Maori health researcher, is that for Maori individuals, the broad community is very important, not just the immediate nuclear family. And so cultural factors can influence your perception of your connectedness and may influence your sense of loneliness as well. That's also part of what made the study so important is that we have three very distinct countries, Canada, Finland, and New Zealand, involved in the study. The interesting thing is each of the researchers in those respective countries came to this finding independently. We were all kind of surprised because there's this conventional wisdom that loneliness can kill you, but in each of our countries, we independently came to this conclusion. Well, in home care clients, we're not seeing that. And it was only when we started talking to each other, then we realized, well, we've got something that is a cross-national, cross-cultural, consistent finding. And that's hugely important as part of the scientific process to come across that.
Lastly, I asked how home care providers prioritize addressing loneliness as a quality of life issue, given its mental health impact and lack of mortality link.
Well, there's this long-standing pattern in healthcare in Canada and elsewhere of the tendency to only justify mental health concerns when we see a physical health problem. So if we look back to, discussions about chronic fatigue syndrome is a good example that we said, well, this really can't be that important. There's nothing physically there that we can see was the thought of the day. And so it's a character problem. You just have to sort of get on with life. And so I think part of what's happened with loneliness is that the finding in some cases that there was a relationship with mortality somehow made it seem more legitimate to talk about as a health concern than if it was only a mental health concern. Our position is that loneliness can have devastating mental health consequences And those mental health consequences are enough to justify taking a concerted effort to address loneliness. So it's a hugely important issue for home care, long-term care settings, primary care, really anywhere in the population. Loneliness is an awful thing to experience, and that experience is enough to say, as a health system, we need to care about the mental health consequences associated with loneliness, because people don't need to experience that. Being part of a community, feeling connected is part of health.